Well, in our Be Healthy report, women who are not considered high risk for ovarian cancer should avoid screening for the disease. Recommendations from the U.S. Preventative Services Task Force suggest only women with a family history of the disease or those who test positive for BRCA1 or 2 genes undergo screening. Research shows 10% of women screened for the disease will have a false positive and a third will have an ovary removed. Well, when it comes to heart disease, studies have long suggested that preventing and treating it in some patients could be as simple as supplementing their diet with extra vitamin D. So what is this relationship between the two? Dr. Runjhun Misra with UConn Health Center is here to explain. Doctor, thanks for joining us.
Thank you for having me.
So let's talk about the association or what we know so far.
Well, vitamin D and heart disease, there are a lot of studies going on right now. But unfortunately, there's no data out that actually shows, is there a positive benefit, is there a negative effect with taking vitamin D? So a lot of people do have questions, you know, whether they should be taking it solely to decrease their risk for heart disease. But the data is long in coming.
Could it hurt?
It can't hurt unless you take a lot of vitamin D.
Okay.
And we can talk about how much you should take, you know, a little bit later. But usually to get toxic, you have to take a lot of supplements.
And some studies talk about vitamin D and colorectal cancer risks. What's that correlation there?
There are some prelim data currently that shows there is a benefit of taking vitamin D that decreases your risk for colorectal cancer.
Okay, so typically on an average day, how much should we be taking?
So the Institute of Medicine has a requirement, or they have guidelines that from the ages of probably 1-year-old to 60, you're supposed to take 600 international units of vitamin D.
Okay, and you can get it from food?
You can.
Which kinds of foods?
You can. So there's 4 foods, I guess, that I should mention. One is cod liver oil. It has 1360, so 1,360 international units. 1 serving of salmon has about 200. 1 8-ounce cup of milk has 100, and 1 egg has 10.
Okay, well, it seems like we're going to have to eat a lot of eggs and a lot of fish. So if we eat some of these foods, you can also get a little bit from the sun, but then again, that's a catch-22 because skin cancer.
Right. And, you know, when I was reading about this and talking to other people, it's very interesting to find out that you should, you know, normally be out in the sun from about 10 a.m. to 3 p.m. To get the most out of it. You should be out for about 10 to 15 minutes twice a week. And the best areas to get synthesis are your trunk and your legs.
Okay, so that's basically just like this part and then your legs.
Right, with no sunscreen.
Okay.
That's important.
Okay.
And sitting in a glass room, also there's no synthesis happening because UVB, the rays, they don't get through glass.
What about the screening guidelines? There are no screening guidelines yet for vitamin D.
There aren't, no, unless you're at a risk factor group, which includes older females who don't have enough, you know, vitamin D intake, or newborns under the age of 1-year-old.
Let's say someone just wants to take a supplement. They don't want to go to town on the eggs. They don't want to be outside in the sun. Are there anything that so what should we know when it comes to taking something? It's over the counter, but it's considered a medication.
It is. And that's something that I would really stress to everyone watching this today and also my patients. It is something you can get over the counter, but it is a medication. So it's very important. You tell your doctor that, hey, you know, I'm on vitamin D. I just want to let you know. And then if your doctor has any recommendations and, you know, any guidelines that you should be following, you really should be following.
Again, the daily dosage, can you repeat that one more time?
It's 600 international units.
Okay.
But we should remember that there are 2 numbers that I want to talk about.
Okay.
A number that's 20 and then 30. So if we take 20 as the number where we find people deficient in vitamin D, that's 75% of the American population. 30, you know, it's about 30%. And what's important to remember is if you want to get up to 30, which is the optimal level, you actually have to take about 1,400 international units a day. And that's a lot.
That is a lot. So if you want to take a supplement, that's fine. Are there any drawbacks to maybe perhaps too much vitamin D?
So the studies are ongoing, like I mentioned earlier, and we don't know because too much vitamin D could cause some calcification of the arteries, so hardening of the arteries, and it could lead to heart disease, maybe kidney stones, but there's no data out currently.
Okay, so it's something you have to take, you can't take lightly. You have to take all this stuff into consideration. Obviously, talk to your doctor about it as well. Thank you so much for coming and clarifying things for us. We appreciate it. We'll still need to get your taxes in with the deadline quickly approaching.